I'd like to ask the Minister for Health and Social Care what the current provision of NHS-funded respite care for older people and those with dementia is.
Minister for Health and Social Care to reply.
Thank you, Mr Deputy President. There are 2 ring-fence beds for people who require nursing respite care on Martin Ward in Ramsey Cottage Hospital. These are provided free of charge to people based on need. Need is assessed based on the modified Barthel score, which is an assessment tool to measure activities of daily living for patients with disabling conditions. The assessment is undertaken by an occupational therapist during each respite stay, and the provision of respite is adjusted accordingly. 1, 2 or 3 weeks of respite every 10 weeks. The remaining 29 beds on Martin Ward are used for step-down patients from Nobles Hospital requiring continuing care or complex rehabilitation. For people who require residential respite care, the department provides or commissions beds in Ramsey, Peel, Port St Mary and Douglas, 16 beds in total, including emergency beds. In addition, dementia care and support services offer 4 respite and 1 emergency respite bed. Except the emergency beds, these are not free of charge. However, they are priced at income support levels, so if the person accessing respite is eligible for income support, they will get support towards the costs charged by the care home.
Supplementary question, Dr Allinson.
Thank you very much, Mr Deputy President. I'd like to thank the Minister for his answer. If I can just pick up on a few points. He mentions that there are 2 beds currently at Ramsey District and Cottage Hospital. Has there been a reduction in the total number of beds, and are these 2 beds available for people all over the island? Secondly, can I ask him, would he agree that respite care is incredibly important for carers to give them the time they need to look after their own health, and that investment in respite care across the island can actually allow those carers to continue their caring, and can actually be incredibly important in supporting people remaining in their own homes? Thank you very much, Mr Deputy President.
Minister to reply.
Thank you, Mr Deputy President. To the best of my knowledge, I don't think there has been a reduction in the number of beds available. I am aware of an instance where they have, because they had a spare step-down bed, they used one of those for respite, but my understanding has always been that it's been the 2 there, but I do stand to be corrected if anyone's got any other evidence to that effect. In response to who's it available to, it is everyone across the island, Mr Deputy President. In relation to Ramsey Cottage Hospital, it's not just for the north of the island, it's a great facility for the whole of our island. It's an absolutely imperative support mechanism that we have within our health service. In terms of the importance and investment in respite, I fully agree with the Honourable Member for Ramsey, Dr Allinson, particularly as we start getting an ageing population coming online. It is absolutely critical that the department is constantly looking at the respite services that are available, because one of the things, I think sometimes we don't realise just how much effort and how much passion carers give in these circumstances, and it's only right that they do have periods of respite. The model is never going to be perfect. I don't think there's ever a utopia that we'll reach, but it is important that where we can, we help those people, because those people are caring for relatives and they are doing a great service out there in the community, Mr Deputy President.